Hey, everybody. How y'all doing? I'm gonna give it a minute. I'll give time for everybody to get in here. I hope everybody is doing well tonight. So I'll just give it a second, wait for you guys to get into the room. We are going to update. We're going to talk about following the money a little bit. I know some of my regular politics folks are going to be asking me about Florida. I do know that Florida just submitted their recount and they were 2 minutes late, so it's not going to count. They're going to have to redo it. We'll take a look at the rest of that later on, probably starting on Monday, and I might do a special one over the weekend just to get caught up on all of that. So how you guys doing? I'll give you guys a chance to get in here. Hey, Christy. What's up, Lena Boo? Hey, Cuz. Hey, Rinda. How are you? Hi, Crystal. You guys are all right tonight? All right. So I want to get into a lot of the other stuff that I have uncovered in the last day or two. And I know that the last 2 days we've kind of switched gears. We've gone from Georgia politics, the Georgia election, the Fulton County elections, and all of that, and now we're deeply, heavily into Ballad Health and what's happening back home in Tennessee. So what I'm going to do is I'm going to give you guys just a brief recap. I want to get you kind of up to speed, and then I'm going to share with you the things that have transpired today, the conversations that I have had, because they are significant. And for some of you guys, it's important that we start asking these questions, because I was shocked by some of the things that I found out today that make how I feel about Ballad Health, how I feel about the COPA, how I feel about SB 2048, all of that is super important. Hey, Deronda, how are you? I know there's a lot of new faces on here because folks from back home have been following me based on this stuff with Ballad Health. So, hey, Becca, how are you? All right, so here's the deal. Just to give you guys a brief recap, for those of you all who do not know, I am from Northeast Tennessee. In Northeast Tennessee and Southwest Virginia, there used to be two healthcare systems that ran that gave medical coverage in that area. The two healthcare systems were Wellmont and Mountain States Health Alliance, right? After those two healthcare systems got themselves into financial trouble, they decided that they wanted to have a merger. When they wanted to merge, the FTC said absolutely not, because that would create a monopoly in this area. And that makes us have pause because of antitrust laws and things like that. So in an effort to get the merger approved, Ballad Health, which was the merger between Wellmont and Mountain States Health Alliance, they agreed to a COPA, which is a cooperative agreement for public advantage. And what that means is, that's in Tennessee. In Virginia, it's just called a cooperative agreement. And what that means is, hey, Jamie, what a cooperative agreement means is simply that Ballad Health is going to provide enough information, and they are going to agree to specific goals and specific things that they want done in an effort to prove that their merger is more of an advantage to the public than it is a disadvantage that there's not any competition, okay? So they did that. The COPA was approved in January of this year. Now, here's what's so crazy is about 2 or 3 weeks after that COPA happened, Ballad had a bill prepared that they wanted passed into law. And they took that bill over to Senator Rusty Crowe and said, hey, Rusty, we want you to propose this bill and sponsor it in the Senate for us. And Rusty said, why, yes, sir, I'll be happy to do that for you, because Rusty is the chair of the Health and Welfare Committee in the Senate. So he did. And he gets 40% of his campaign donations from medical associations throughout Tennessee. So, of course, Rusty was happy to sponsor this bill. Now, what SB 2048 did for Ballad Health is it gave them a little bit of a loophole. See, the COPA agreement not only said, hey, here are the goals that you have to meet. In other words, we want you to keep our hospitals open. We want you to have, we want you to lower mortality rates. We want you to do all of these things. Hey, Renda, baby. That it also said part of the COPA agreement was that the state would have a committee, the Department of Health would oversee the COPA, and it would ensure transparency about the things that Ballad was going to be doing. In other words, they would have a firm or an individual that they could hire or they could assign to investigate, to monitor, to oversee the things happening within Ballad. And that information would be a matter of public record, okay? Now, SB 2048, which was sponsored by Senator Rusty Crowe and passed in the Senate, said, oh no, there are some things that Ballad needs to keep private because they need to remain competitive. Well, the first question that I had in reference to that is, well, you want to be competitive against who? With this merger, you now control 71% of inpatient care. So who's your competition? There is no competition, right? Now, do I understand, because I'm not unreasonable, I understand the need to keep business plans and marketing strategies and business audits and things like that private. I get that from a business perspective. Hey, Janice. Hey, Mallory. But what I don't think should have been allowed to stay private were things like facility closures, changing in services, repurposing hospitals. So, for example, even if you agree to keep a hospital open, you can repurpose it, right? You can do anything that you want to. You can take away different things, okay? So follow me. So that's what SB 2048 allowed them to do. And they had that bill ready literally 3 weeks after the COPA was approved. So then what happened is, once that got approved, if you guys look back, and I started to go back and take a look at Ballad Health, and I looked at like their social media posts, and I looked at the things that they were promoting, and all they've been promoting for months now is Niswonger, Children's Hospital, JC, and that's all they've been promoting for a while now, right? But I didn't know that. I don't live there. And so it's just been kind of like the writing has been on the wall. Now, here are the things that I found out. In this COPA agreement, okay, the language says this. Here's what I want everybody to understand. Ballad can act like they have their heels dug in about these choices. They can act like that. They can call meetings with you. They can tell you that this is what they've decided. They can do all of that. At any point in time that the Department of Health or the Attorney General determines that this COPA is no longer in the best interest of the public. In other words, you guys are not being protected, and it's not to your advantage, and you would benefit from maybe different competition being in the region. They can terminate, modify, suspend. They can do anything that they want to with this COPA. This is the verbiage, guys. It says, This COPA is subject to modification if at any time the department determines that the likely benefits resulting from the cooperative agreement no longer outweigh any disadvantages attributable to any potential reduction in competition that may result from the COPA. So here's the bottom line, folks. The Attorney General and the Department of Health, these are the people that you need to be talking to right now. You need to be filing a complaint with the FTC. These are the things that need to happen, because here's what they've determined to do. And I need to clarify a couple of things, because sometimes when I get a little emotional and I get a little wound up, I will talk too fast. So I was talking about levels of the NICU and levels of trauma centers, and sometimes I got them interchanged. So let me just go ahead and clear that up for everybody. The NICU center that is at Holsten Valley and the NICU center that is in Johnson City are both level 3 NICUs. They are the same. There's not one that's any better than the other. The trauma center that is at Holsten Valley is level 1, right? Which is the highest for adult care. And the trauma center that's in Bristol is a level 2. With this new deal, here's what they want to do. They want to take Bristol's trauma center, hey, Shari, all the way down from a 2 to a level 3. They want to take Holsten Valley down from a level 1 to a level 3, and they want to have Johnson City be the only level 1. Here is the problem with this, folks, and this is the part that really angers me. So remember I told you about Senator Rusty Crowe, who sponsored this bill on behalf of Ballad? Well, the reason why he did that is, do you want to know what his district is? He's District 3. Well, what does he oversee? He's Johnson City. That's his constituents. So do you think that it's a coincidence? Do you think that it's a coincidence that Ballad Health took their bill to Rusty, and now Rusty City is getting the level 1 trauma center and the upgraded NICU unit? Like, that's just insane. See, and thank you, Mike. Absolutely. You have to remove the corruption. Now, I'm going to give you guys a piece of information that floored me today, because I have, in fact, talked to the Department of Health today. I did, in fact, talk to one of the 3 people who oversee the COPA today. Matter of fact, we had a 24-minute long conversation and exchanged a couple of emails afterwards. I'm pretty excited about that. What I learned, though, is that Senator Rusty Crowe doesn't just sponsor legislation for Ballad Health. He's not just a senator. He's not just over the District 3 where Johnson City is. Guess what else? He is a contracted employee for Ballad Health. Hey, Leandrew, did y'all hear me? Senator Rusty Crowe gets paid by Ballad Health as a contractor for certain services for them. And then he took a bill and he sponsored it in legislation for them that allowed them to keep information private from the public. That should be alarming to you all. That screams of corruption. That is not acceptable. I literally had the state tell me that that's been their greatest frustration in how to deal with this, is being undercut by him passing that legislation after the, Terry, I don't know anything about a Stark violation, so educate me. Tell me what that is, because I don't know what that is. But I'm going to read to you guys exactly what they told me he does. Yeah, I told y'all, I've been a busy little beaver finding out lots of information. So I am in direct contact with both Alan Levine, who's the CEO of Ballad, and I've been in direct contact with Tony Keck. Tony Keck is the EVP of a whole lot of shit. It's a real long title that I'm not going to bother to read. But they have agreed to meet with me, Tony, Lisa Carter, who is the CEO of the Children's Hospital, and then one maternal prenatal doctor. But this afternoon, about 4 hours ago, I messaged Tony and I said, hey, Tony, can you confirm for me that Rusty Crowe is also employed by Ballad? And this is what he responded to me. And he said he contracts with us to work with the physician community on wound care and hyperbaric medicine. I have a problem with a senator working for a healthcare company, sponsoring legislation on their behalf, and in return, getting his children's hospital, his trauma centers upgraded, built up, money invested. That's a problem for me. Meanwhile, you want to take away a level 1 trauma center in Holsten Valley, which is right by Eastman. So y'all tell me something. If it makes sense anywhere to have a level 1 trauma center, does it need to be in Kingsport, where you're right beside Eastman Chemical Company, or does it need to be in Johnson City beside ETSU? Y'all tell me which one makes common sense. This is literally a tit for tat, folks. This is what we're talking about when we're talking about politicians receiving money. We're talking politicians getting their stuff greased by lobbyists. Let me tell you something. I've done a little research about Tony Keck. So check this out. Tony Keck came to you guys from South Carolina. And you will hear him talk about what they were able to do with infant mortality rates in South Carolina. I want you to go and ask people in South Carolina how they feel about Tony Keck. Do you want me to tell you how they feel about him? Here's how they feel about him. They are super pissed off because the entire time that he was there as a lobbyist and he was working with their governor, he was against expanding Medicaid. He didn't want it. He lobbied against it, said it wasn't supposed to happen. He gets to Wellmont, where Ballad is going to happen, and that's their main agenda. And all of a sudden, he changes his tunes and says, oh, well, you know, it's good for some states and not for others. Okay, I'm going to come back and read some of y'all stuff. I know. So let me tell you this, Joy, when you talk about Holsten Valley as the center of your service area, it is. And I'm going to tell you guys something that's probably not going to make you happy, because it did not make me happy either. But check this out. So part of the COPA agreement that they made with Ballad, listen to me, they knew a year ago that your trauma centers were going to be merged. They knew a year ago. Well, let me just say this. The COPA was approved in January. So I can tell you that as of January last year, when they finalized this COPA, not January last year, January of this year, when they finalized this COPA, in the terms of the COPA, part of it was that the State Department agreed that Ballad could merge your trauma centers and that the State Department would not get involved in and try to make them put the trauma center in one place or the other. Now, I will tell you this. They told me directly today that they had hoped that it was going to be in Kingsport at Holsten Valley because it made better sense logistically, because it was more centered in terms of the service area, and because of Eastman being there. Yeah, so this is my thing. So that's exactly my point. See, I'm so glad you're saying this because I don't live there anymore. So let me say this to you too. When I'm talking to these folks, I do not give them the names of the people who are giving me information. But I grew up there. I don't live there anymore. My mama does, my daughters do, my grandbabies do, but I don't live there anymore. So if you have information that helps me support this case, inbox me, give it to me, send it to me. Because these are the things that I need to know. There needs to be a human component to this. And people need to understand what's happening. You guys are a classic case for political corruption and corporate agendas when it comes to politics. This is nothing but a corporate agenda. That's all this is. The fact that Rusty Crowe can somehow pass legislation for the healthcare system that he contracts for on the side that gives them an out and gives them the ability to hide information that would normally be public as part of the COPA agreement just sickens me. And it is time to vote every single one of these crooked ass politicians out the door. He's up for election in 2020. Bye. Bye, sir. Bye. Joy, here's what you do. You want to fight this? You call, I've got numbers for you guys. You guys know I have numbers. I have numbers and I have names of people for you to call. You call your attorney general, you call the state health department, and you call the FTC. Those are the things that you do. So they ask me, well, let me back up for just a second. How do I want to do this? So one of the things that they ask me is, well, what were my suggestions? What were my recommendations? Because these are the things that I brought up that were areas of concern for me, specifically about the NICU and about trauma centers. And this is what I said. I said, well, if it were me, now granted, I've never ran a hospital, right? But I'm also not dumb, you know what I mean? So this is what I said. If it were me, rather than spending this money to build pediatric ERs, because we're not hurting for that. Like right now, if you go to the ER in Bristol, there's another section where they take the kids anyway. Like, oh, it's okay. There's even a little waiting room for kids. It's like small, but it's little. Like they don't need fishes and shit on the walls right now. You just need healthcare, and we're good with that. So what I would do before we spent money building 2 brand new pediatric ERs that they don't even know where they're going to put them yet, right? Before we did that, what it would seem to me is I would leave the NICU at Holsten Valley exactly like it is, because it makes the most sense in terms of the care and the need for that region. I would leave the trauma center exactly like it is, especially considering the industries and the businesses that are in operation around it. Then what I would do is either, in my thought process, without knowing a lot of detail, y'all, like too much detail, is I would have a trauma center and a NICU either in Abingdon, because Abingdon's hospital is pretty new, right? Or somewhere between Abingdon and Smith County. Right now, the whole Southwest Virginia region from Smith County all the way down does not have access to a trauma center at all until they get to Bristol. And the plan is to downgrade Bristol from a level 2 to a level 3 trauma center, which guess what? The folks overseeing COPA did not know that until I told them today. The folks overseeing COPA had never seen the new map that they've been flashing on the TV screen. They didn't know that, and they expressed concern about that to me. So my thought process would be, so think about this. If you have a NICU if you have a NICU in Holsten Valley and you have one in Johnson City, and then you put one in Abingdon, what then happens is even the people that are in some of the most outer-lying areas, they can reach a NICU within 35 to 45 minutes, rather than the hour and a half that it takes them to get there now. You have folks that are over in, the Duffield areas and the Wise and Russell counties. It takes them a while to get to care. And that should not be the case. So here's what happened. I need to read the rest of this to you guys. So I sent a message to Tony earlier today, and this is what I asked for. And I told you guys that I'm going to be as transparent as I possibly can during this process so that you hear what's being said to me, okay? I said, good afternoon, Tony. One more thing. In an effort to truly provide the best options for resolution, can you tell me the breakdown? Can you provide the breakdown of this plan that you all have announced? In other words, what's it going to cost to build the pediatric emergency rooms? How much are you going to save by closing the Holsten Valley NICU and downgrading their trauma unit? This way, I can currently assess how I would recommend those dollars be spent. I'm happy to sign an NDA as I understand the sensitivity of this information. Now, I knew I was offering to sign an NDA. I knew his ass was going to tell me no, but you don't know if you don't ask. So I asked. The response that I got was really simple. Danny, I can't really send you anything proprietary, NDA notwithstanding. If I were them, I wouldn't give it to me either, but I'm just saying, I ask, right? And he said, but I will assemble for you a number of plans related to our merger, which are public, but probably not read by too many people, which outline our new investments in population health, behavioral health, blah, 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 blah. Here's what I said. Send me everything you got. Send me everything you got, because I'm able to decipher a few things, right? I was able to read your COPAs and understand. I was able to read, SB 2048 and understand. Send me what you have. And so what I'm going to do is take a very basic approach to the dollars that I see. Hey, what's up, Linda? And then when I meet with them after Thanksgiving, then this is what I'm going to say. This is what is reasonable. Now, in the meantime, here's what I will tell you. Hold on a second. That doesn't happen. So they have to bring all the kids to Roanoke. Yeah, Shari, I know. So if you're in, I almost had to give birth in Wytheville, and I was like, I am not giving birth in Wytheville, Virginia. I was like, it is not happening, not in this hospital. No, thank you. I was like, I'm either going back home because my daughter, I had a high risk pregnancy with my second daughter. My youngest daughter, along with my granddaughter, were both born at Holsten Valley. Now, luckily, my daughter didn't have to go to the NICU, but my grandbaby did. She spent 91 days in Holsten Valley. Some of her amazing, incredible nurses are on this live right now, and I just love them so much, which is why I'm so passionate about making sure that this bullshit does not go down. So here's what I want you all to take away from this. A, it's not over. At any point in time, this COPA can be adjusted, suspended, revoked, terminated, whatever needs to happen, modified, right? So this is when you apply the pressure. Right now, this is all over social media, and they are not happy about that, right? So what do? Now is not the time to take the gas off. Now is the time to put the pedal all the way to the floor. This is what you do. You go all the way in and you go hard. You call your congressmen, you call your senators, you tell them about Rusty Crowe, you call your media, you call your attorney generals, you call the State Department, and here are the names and numbers of people that you need. So the COPA oversight and monitoring team, you want to talk to either Jeff Ackerman or you want to talk to Elizabeth Jones. The telephone number for Jeff Ackerman is 615-532-3188. The telephone number for Elizabeth Jones is 615-253-8433. 883. The telephone number for the Attorney General is 615-741-3491. The telephone number for the Consumer Division of the Attorney General's office is 615-741-1671. Those are the numbers that you need. The numbers that Ballad is quoting for Holsten Valley Medical Center's NICU are skewed. They are only that low because they started diverting babies from Holsten Valley, period. When my grandbaby was born there 14, 15 months ago, it was packed. And it was packed for an entire year before that and the entire last year. They started sending babies to Niswonger like the last however many months and diverting those numbers so that they look like what they are. This is a NICU that is full, that is amazing, that is excellent, and it makes sense. It is not fair. And by the way, this whole there's only 20 minutes between Johnson City and Kingsport bullshit is not true. Go to Google Maps, type in Holsten Valley Medical Center to Johnson City Medical Center, and guess what you're gonna see? You're gonna see that it's a 45-minute difference. So what you have, let's just say that I'm in Rogersville and I'm about to give birth early, right? And my baby is going to be 26 weeks like my granddaughter was. Well, instead of being able to drive 35 minutes to the NICU at Holsten Valley from Rogersville, I'm now going to have to drive all the way to Johnson City, which is going to be close to tripling my driving time. Any idea how much time that and what that means potentially for a high-risk baby? Yeah, the trauma numbers are skewed as well. Exactly. See, and this is the thing, guys. This is not a conspiracy theory. This is not us like just guessing. That's not what this is. This is real stuff. Here's what you have, folks. You have two healthcare systems that chose to merge. They want to save all this money by diluting and services and telling you that they're duplicate services. Guys, they're talking about telemedicine. Here's my thing. A hospital FaceTime is not an adequate replacement for a level 1 trauma center. A hospital FaceTime is not an adequate replacement for a level 3 NICU center. That's the most ridiculous thing I've ever heard. You can FaceTime me, but if I don't have the equipment, if I don't have the staff, if I don't have the expertise, those babies and those people are going to die. Because especially you talk anytime in the wintertime, what are the roads going to be like trying to travel? There are times I don't go home for the holidays. Lives matter, and lives matter more than your money. And that needs to be a message that is clearly sent to our health systems, and that's clearly sent to our politicians, that is clearly sent to Rusty Crowe's office. And if I were y'all, I would be blowing his ass up come tomorrow, because he's double dipping. He's getting paid by Ballad Health, and then he's submitting legislation for them. Yeah, Deronda. Oh, that was what Alan Levine told me via my Twitter DM yesterday. We are literally talking about less than 100 premature babies at Holsten Valley Medical Center. And here's my thing. Honestly, I don't give a shit if it is 100 babies. 100 babies' lives matter to me. Call me crazy, because it does not have to be this way. This does not have to be the solution. It does not have to be this way. That's the truth. This is a choice for monetary gain. Period. So I'm going to go through the numbers one more time. And by the way, in case you guys think that this is like something that doesn't really affect anybody, do you all know how many people live in Northeast Tennessee and Southwest Virginia just by like a county estimation? There's over 800,000 of you guys. $800,000 people living and affected. And they are controlling 71% of your inpatient care, not to mention all of your medical employment opportunities just about. Right, Brittany. I know. When Bella was there, so somebody send me those stats. When you tell me over 250 babies in your NICU last year in Holsten Valley, send me that. I'm so serious. There's too much corruption in politics that's affecting our lives. This is the livelihood of people. People's lives matter. I don't care where you live. I don't care what color you are. I don't care what your religion is. I don't care what your political affiliation is. I don't care any of that. People matter. Babies matter. It matters. And we have to not get frustrated. Don't get scared. This is what cautious bravery looks like. That's what I call it. I call it cautious bravery. Because if y'all don't think I haven't been like, holy shit, I'm like, and I got a little testy with Alan via Twitter. And I was like, you are telling a CEO, like a millionaire, about himself and whatever. You know what I mean? But here's the thing. Who are you? You're no better than me. Your life is no better. Your life doesn't mean anything more than mine. Your children's lives are no more important than whoever's working down in the coal mines, whoever's working in the fields, whoever is doing construction. Your babies' lives don't matter any more than those folks' babies' lives. Just because you have that you make $1 million a year doesn't mean that their babies don't matter. They matter. Yeah, you think about this. Who's paying for transportation? Who's paying for, like, what do you do with a baby and this is what I said to the COPA monitoring team today when I talked to them. I said, here's the thing, folks. We don't want these babies to just survive. We want them to thrive. So while you're talking to me about evidence-based best practices, it's evidence-based best practices that these NICU babies need to be breastfed, that they need kangaroo care, that they need to hear mommy and daddy talk to them. How many people living in these rural communities can take off work 2 or 3 or 4 times a week? And who's got the gas money and reliable transportation to drive 45, 50 freaking miles to go see your baby? What mama wants to be an hour to an hour and a half away from your baby who's in the NICU? Nobody that I know. When my daughter gave birth, God bless my friends and family from Facebook, because I literally put up a post on Facebook and a link to my PayPal account. And I said, hey, my babies, my daughter, because my daughter was so early. Bella was born at 26 weeks. There was no maternity leave. There was none of that, right? So bottom line was, after that, they were on their own, down to a 1-to-1 income. They lived in Bristol. Baby born all the way in Holsten Valley. And we paid for discounted rooms when the hall had them available. And when they didn't, we got a hotel room. And so we raised money. But this is what people have to do. Not a lot of people, not everybody has people who will say, hey, I got your room for tonight. I got this for tonight. I got that for tonight. I know what it's like to have to raise money or to ask people for help because you want to be there by your baby. You all get it to me and you inbox it to me. I have been sending everything that I have been getting, not giving names, but giving the data, giving the information on to the people who need to have it. Right, Heather. I am with you all the way. This is not about the well-being of people. And I personally believe that if you're going to run a hospital, you should have to take the same oath that doctors and nurses do. Stop running it like it's a business or a tech company. This is not Silicon Valley, folks. You are talking about the lives and the mental and emotional and physical well-being of people. It all goes together. And your bottom line is not more important. Jamie, I have heard reports of different places that have been threatening people to stay quiet. Here's what I will tell you. I received a report that a state medical, I'm being careful with the way that I word it because I'm always careful. I don't want to out people. So I had received word that a state medical agency, I read it. I had received information that a state medical agency had called local agencies in Virginia and threatened them to calm it down on Facebook. So I sent an email to the head of that state department in Virginia, And this is what I said. I said, good morning, Gary. As you know, Ballad Health made an announcement regarding major changes to trauma and NICU services impacting the Northeast Tennessee and NICU services and Southwest Virginia regions. As a result, many people have taken to social media to express their concerns and exercise their First Amendment rights as to the impact these changes will have on themselves, their families, and their communities at large. I was recently informed that state-level offices like yours have reached out to local facilities telling employees to calm it down on Facebook regarding Ballad Health. As you can imagine, this is extremely concerning. And before I take this information as fact, I wanted to reach out to you for confirmation. Has your office or any other state office that you're aware of told employees to reduce or stop posting their concerns about Ballad Health on social media? Your prompt and thorough response is greatly appreciated. I haven't heard shit, and that was at 12:07 p.m. today. You know, here's the thing. This is where, so let me tell y'all something. Do you know what's going to happen if they start threatening you guys? Document it, folks. You want to know why? Here's the thing. This is where they will violate their COPA. Because if they weren't a monopoly in that region, if they weren't a monopoly, they couldn't threaten you like that. Do you understand? Having this merger makes them a medical monopoly in this area. And what they're doing is when they threaten you and they tell you that you can't voice your opinions, when they threaten your employment, when they threaten your livelihood, that is a violation of the COPA agreement, because if there was competition in the region, they wouldn't get away with that shit. So go ahead, document it. When they send you threats, when they call you in for a meeting, turn that voice recording on. Let me tell you something. Tennessee is a one-party consent state. As long as you are part of the conversation and you consent to the recording, you're legally good to go. Record it. Send that shit to the TV station. Send it to the COPA team that I just gave you numbers on. They want to threaten people to keep quiet. That's when you get louder. That's when you get louder. You don't control people. You don't threaten people. You don't scare people while you're sitting with your $1 million bank accounts. And all people want is to make sure that their babies don't die. All people want is to make sure that they don't have to drive an hour and a half to try to get decent trauma care. How dare you threaten people? Meanwhile, you're poisoning that whole city and always have been. And Eastman gets away with poisoning the damn city because they give good jobs. Oh, well, we're going to pay you. We're going to pay you great. Now, you might die, or like half the city might have cancer, but we're going to pay you really good. What in the world? All right. I'm going to give you the numbers again, folks. Okay. This is how, if they are threatening you to be quiet, you document it. You document it, because it is a direct violation of the COPA, guys. The whole thing about the COPA is that if they determined that it was less beneficial for you, for them to have this monopoly than to have competition come in, then the COPA could be null and void and be done with, and there is no more Ballad Health. Just saying. And I know, let me say this to you all. I know that it's scary. I know that this is scary because your lives and your livelihoods are at stake. Here's what I will say to you though. You don't fight, we die anyway, right? If I'm going to die fighting. It's just the way I'm built. That's why I'm a disabled veteran, right? Because that's the mentality that you got to have. Just saying. I'm going to give you these numbers. Somebody do me a favor, and I'm going to slow it down because I get really excited and passionate. I'm going to slow it down. I'm going to give you these names and numbers. Somebody type them into the comments for me, okay? So here's what we need to be doing. You need to be calling your state health departments in both Tennessee and in Southwest Virginia, okay? You need to be calling your state attorney general's offices. The state, the attorney general's in Tennessee is Hurley, Lord, what's the man's name? I done wrote it down from last night. His name is Herbert Slattery. Herbert Slattery is the attorney general in Tennessee. Mark Herring is the Attorney General in Virginia. You want to be calling both of those two gentlemen. In Tennessee, and I don't know why I don't, let me give you, here are the state attorney general's phone numbers. For Tennessee, the attorney general's phone number is 615-741-3491. That is the Tennessee Attorney General phone number. His name is Herbert Slattery. Now, I was informed today that Herbert doesn't take phone calls. That's okay, Herbert. We don't really want to talk to you anyway. You can talk to the Consumer Division, and the Consumer Division is 615-741-1671. Ask for Emily. I talked to her today. She's supposed to call me back tomorrow. Actually, she said she'd call me back once she talked to the person she needed to talk to. I never got a call back, but that's the number to reach Emily, okay? That's what you want to do. And who's taking numbers down? Who's typing numbers for me, folks? I can type them if I need to. Hey, Mendel. Y'all got it? Anybody got numbers for me? Somebody type numbers. I'm going to give it to you again. Attorney General, 615-741-3491. The Consumer Division, 615-741-1671. The Health Board is 615-741-3111. When I get off this live, guys, I will go up and I will edit the description, and I will put all of this in the description as well. Awesome. Thank you, guys. Mark Herring for Virginia, his number is 804-786-2071. 804-786-2071. This is the number, these two numbers right here, I really want you to get. This is for COPA. This is for COPA. You guys ready? Here are the two names. Jeff Ackerman. Ackerman is spelled Ockerman. Jeff Ackerman, telephone number 615-532-3188. Elizabeth Jones. I don't think y'all need help spelling her. Elizabeth Jones, 615-253-8483. Those two names are the people directly involved with the COPA. Call them. Thank you, Emily. You got it. Perfect. And somebody needs to shout it from the rooftops that Rusty Crowe should not be employed or contract employee for Ballad Health and then be passing legislation for them that allows them to keep information private from the public, when the whole purpose of the COPA was to make sure you guys knew what was happening. They've known about these changes, folks. They've known about them. Merging your traumas was part of the COPA. They just thought that it was going to go to Kingsport, and instead it went to Johnson City. And in my opinion, it went to Johnson City because that's where Rusty Crowe's constituents are. That's his district. You can fight this. You have a case. You have a leg to stand on. You guys have it. You do. You have it. So I don't know. Oh, wait, I need to give you one more. Y'all ready? Call this. I got some yummy goodness for you today. You want to call the Tennessee Alliance for Legal Services. There may be a way for you guys to have some sort of class action or some sort of civil liberties case. I'm not really sure. I'm not an attorney, but let me give you this, okay? The Tennessee Alliance for Legal Services is 1-888-395-9297. 888-395-9297. All right. That's all I got. You guys are more than welcome. Thank you, Emily, for throwing that up. Awesome. You guys do have a leg to stand on. You do. And I'm not, so let me say this. I'm not even saying run Ballad out of the water. I'm not even saying that. What I'm saying is make them have an honest conversation where they take into consideration what's truly best for this entire region and for all of the people that's affected. You know what I mean? This is important. You're welcome, Jessica. You really are. Here's what I know. You make me happy too, Heather. Here's what I know. A year ago, I did not know if my daughter and my granddaughter were going to make it. I got a phone call on a Wednesday afternoon. My daughter had gone for just a normal ultrasound, and she called me and she said, Mom, they're putting me in the hospital. We have to go home and get a bag. And I said, they're putting you in the hospital when? And she said, now. And I said, why? And basically what had happened is the flow from the placenta had already stopped. And if it reverses, that's when both of them can be in trouble, mom and baby. And so my daughter got put into the hospital that Wednesday. I floored it from here to Atlanta, and I got there at 6 o'clock. And I have so much gratitude in my heart for the surgeons, for the nurses. When Dr. Kromansky came out after doing the surgery on my daughter, because there was the possibility that after this surgery, my daughter was not even going to be able to have kids again or to have them normally. There were a lot of concerns for us. And when Dr. Kromansky came out and I took her hands in mine, this is no lie, and I took her hands in mine and I said, thank you. And she said, you have to be like the most grateful mom I've ever met. And I said, no, you don't get it. And I took her hands in mine and I said, you didn't lose your way. Like you knew that this was your purpose. You knew that this was what you were designed to do. And you didn't get distracted by beer pong parties and sororities. You stayed on course. You spent hours studying and you missed parties and you missed dates and you stayed on course. Because this day, at this time, in this moment, you were destined to be here for my daughter and for my grandbaby. And that's what I know. And I said, and I probably love these hands, and I'm probably more grateful for these hands than your mother could ever be. Because you brought me my daughter back and the ability for her to have babies. And there was Bella. And I will never forget the day that Bella came out of that OR. I will never forget it. She fit from here to here. And I know beyond a shadow of a doubt that it was God and the nurses and the doctors at that NICU that made it possible for her to be here. And there is no amount of money in the bank. There's no legislation that you can pass. There's no corporate agenda that will make me back down from this fight. Not one. Not one, folks. Crooked politicians, dirty money, dirty corporations, and people getting in bed at the expense of people who don't have the help that they need is over. Not doing it anymore. I love you too, Brenda. I do. I love my NICU nurses and trauma too. All right, folks, that's all I got. I'm going to get out of here. We got this. They just don't know it. They just don't know it. But we got this. You have a legitimate issue and people need to know about it. Okay? All right. So take care of you. If you are new to my lives, I end every live the same way. And this is what I always say. I say, be amazing, be light, and be love. Take care of each other. I'm out. Peace.